Hey guys, Dave here. Want to make sure we're right on time at 8 o'clock. I'm going to just give you guys, some people, a few minutes here to get situated. And my glasses are always crooked. That's what happens when you sit on them too much, huh? The struggle's real when you get older. So I promise my glasses aren't an indication of my knowledge level. So if you see me, give me a hand wave, and we'll wait just a couple minutes here, and then we'll get the live session started, okay? All right, a few people coming in. Do me a favor as you log in there. If this is your first time watching one of my live sessions, just say, hey, first time. I'm going to be covering a little bit of everything tonight, get a lot of preparation, but also hope there's some questions coming from you guys that I can, help you make some good choices. So we'll just wait about another 1 minute here. And it is cold here in Missouri. I don't know about where you guys is, but it's cold. Man, glasses. All right, there we go. It's a little better. And the nose always itches when you do a live session. That's goes without saying too. All right, another minute here. And if you guys have any friends that are nearing retirement, or not even they're nearing retirement, basically anybody over 50 years old should be listening to this information. So just type their name, tag them. That way, even if they're not a part of this live session right now, they'll be able to watch the video later at their convenience. The whole video will be saved on our Facebook page. Another reason to like the page and follow us. We do these live sessions, and there's a lot of back and forth interaction with questions. Hopefully there is tonight. There's no such thing as a dumb question. I can assure you, after 15 years of working with postal employees, I've heard it all. There's no such thing as a question that somebody else wants to ask, okay? All right. Congratulations, Gary. 39 years is a long time. A long time. I didn't think there was any civil service left, but I guess there's a few of you guys still left. Again, tag your friends. They're going to thank you for it, because this kind of information is not floating around out there just anywhere. It's specialized information, and if you want to retire and not have any mistakes, you better talk to somebody who does it all the time for a long time. That'd be me. 15 years is a long time doing anything. Scenarios. I've seen a lot of scenarios, actual sitting down with employees, okay? A lot of people think I used to work for the Postal Service. I haven't. I've just had 5,000 conversations with post office employees, so I know the lingo. I know a lot of stuff. So not trying to be braggadocious, just letting you know that I'm going to be hopefully talking at your level and communicate with you with some information you can use, okay? All right, about 30 more seconds here. We're going to get started, okay? If you have a question, man, my nose, that you'd like me to answer, go ahead and post it, and I'll scroll back through. I got just a couple things I want to do here, a little introduction, just to kind of set the table. Try not to be too lengthy. Some of you guys, it's 9 o'clock at night, and you got to get up and go to work, and I want to be respectful of that, but I also want to make sure you guys find it useful, right? All right, let's go ahead and get things started here. Some people on these live sessions, you just have to like and follow our page to be notified, all right? So some people are, not sure how to do that, but hopefully you got the notification. You tag your friends. They can come on in at any time. Just tag them whenever you'd like, okay? First things first, I am not an expert video producer, okay? I'm not even an expert technology guy. Far from it. See here, I'm having to open up my iPad. But I'm trying to make sure the value of the content is more valuable than the production value. Meaning, this is not going to be a high-tech video, but I'm hoping the information is going to be useful, where you can use it to make choices that are best for you and your family before you retire, right? We don't want any mistakes. Second of all, I don't have every answer, okay? Anybody that says they have every answer to every situation is lying to you, and you need to run like hell from somebody like that. It's just that's not something someone says, unless they're trying to mislead you, okay? And then also, if you find it helpful, when you get done, maybe you don't want to tag your friends yet, tag them later. Don't care. This will be up on our page for a long time. But I can assure you it's going to be good information that you can use, okay? The other thing I want to kind of emphasize, this is not a replacement for going to a seminar. Our seminars are about an hour and a half long. They go through the full gamut of all the information. And then after the seminar, for the 2 or 3 days following the seminar, you can set up a one-on-one appointment with the person that did the seminar to go over your specific situation, okay? That's where the rubber hits the road. That's where we can look at your specific situation and find out what you should do. Okay. Now, the other thing I want to kind of just put this warning out there. Some of you are part of Facebook groups that have people that comment or ask questions. And the unfortunate thing about Facebook groups is everyone just throws an answer out there, and almost nobody, they're speaking from their own personal situation and not factoring in your personal situation, right? So don't just take your advice off a Facebook group. Be sure you ask, nobody's really qualified. I mean, the person that works through their entire retirement and they retire once, they've had one retirement scenario they've handled, right? That's not very many. How about somebody that's been doing it 15 years and I've had 5,000 of those conversations? That's a little bit more well-rounded, and the odds are probably have seen a scenario like you're dealing with now that we can actually help you with. But be careful in Facebook groups. Facebook groups are great. They're really good about craft specific questions. Can my postmaster do this? Or what about I'm CCA, I'm about to go career? Great, okay? But when it comes to retirement, please qualify who's giving you the information, how long they've been doing it, and should be pretty easy to do. Okay, I'm part of a few Facebook groups. If you have a group and you'd like to have a retirement expert as part of that group, I'm happy to do so. You just need to introduce me to the moderator, have them send me a message. I'm happy to do so. I've actually written a few articles for postal unions in the past. I haven't done it so much here lately, but it's something we can do, or I can do at any time. Okay, any questions so far? All right, I appreciate you guys tagging some people. And I got a couple people. What's cool about doing this 15 years, I've had several people that have taken advantage of the advice we've been given for 15 years. And I'll tell you, 15 years ago, it wasn't out there. So when I see, comments from Charles, use your sick leave. Yeah, absolutely. But a lot of management don't want to hear that, but that's neither here nor there. Other thing, if we're not having a retirement seminar near you, and I'm about to bring up a list of seminars that are coming up, okay, we can still help you over the phone, right? We can still review your situation over the phone. So that's something you can definitely do. I'm going to bring up a phone number that at any time you guys can text us your questions. Maybe you want to see if there's seminars in your area. Maybe you need help with your retirement paperwork. We do that all the time, okay? We help people with their retirement paperwork every day. It's not a big deal. We don't charge anything. It's kind of just an extra service we offer that helps people. I heard of some lady that's charging $400 or $500. That's a ripoff. Do not pay somebody to help have them do your blue book. That's just a waste of money. Also, if we have a full listing of all our seminars all the time at postalretirementseminar.com. You can actually subscribe to that, and you'll be notified when we add more seminars, okay? So just trying to give you guys some information that'll help. You definitely want to remember postalretirementseminar.com. That's where you can pre-register for seminars in your area. We notify you through the mail. We support the Postal Service, right? We want to use mail as much as possible. All right. Let's get started here. And I do have a few questions that came up on the original post that I put last week when we announced this. But I kind of want to start at a basic level. I'm not sure where you guys are. Sometimes you guys have, I've got this specific question, but you're not aware of some of the other questions you should be asking. So I want to try to go over some high level, some of the, major things that I would want you to know if I was somebody sitting out there and, didn't know which way to go. Okay. Elizabeth, I have not forgotten your question. I'll come back to it. Don't let me forget. And that's a good question. All right. First off, I want to kind of cover some life insurance situations. A lot of you have, or all of you, if your career, have free life insurance, your basic. But some of you are paying for multiples of your base pay. And I just want to make sure I illustrate what happens to that as you get older. Some know, some don't. But I wanted to make sure you guys were aware, okay? Right here. So this is a postal employee that has a $60,000 a year salary, and at age 35, he gets hired on. And you can see what the cost does as you get older, and you can see the total. If he decides to cancel it, when he turns 65, he's paid $50,000. He or she's paid $50,000 into that insurance. And then when they decide to cancel it or reduce it, how much do you get back? The answer is zero. You rented an apartment when it comes to insurance your entire career. Now, again, it's cheap when you're younger, right? $6 a pay period is pretty cheap. But when you get to be about 55 or 60, now you're talking $100 to $200 a month. This is when we start asking people to look at their situation. Now, not everybody needs a lot of life insurance. As you get older and you contribute to your TSP, if you die prematurely in retirement, The TSP becomes the death benefit that your loved ones are going to use, right? So as you get older and you save some money, you can take some of those expenses away, right? So I wanted to make sure you guys had that information. You can also have coverage on your family, your spouse, if as long as you want to pay on it, or your kids up until they're 26. So just want to make sure you guys have that. If you're not sure what insurance you're paying for, there's a code on your check stub that starts with IN and then a number and then another letter. That tells us what insurance you have. We can kind of go over what you're paying now as well as later. Anytime you have a question, just comment, or you can also, that number at the top, 314-916-8858, you can text us at any time. So if I were you, I would put that in there as retirement help. And that way, when you have questions now or later, or your friends have questions, they have a way to reach out to us outside of a live session on Facebook. Does that make sense? Great. Now, a couple things. Now, you guys are close to retirement. You're like, Dave, I already knew about the cost of insurance going up. This is kind of not a big deal. But how about how to reduce it or cancel it? You can reduce or cancel your multiples of base pay or any insurance for that matter whenever you want, but it's not something you can do in Postal Ease. You have to fill out forms, mail it to shared services, and then they mail you a copy back. If you're someone who would like to reduce or cancel your postal life insurance, just comment, say, I need some help with my postal life insurance, and we'll reach out to you after the session's over and get you that help, okay? And I thought I had some postal books. I have a book that I wrote while I'm thinking about it called The Postal Book. It's kind of like a Cliff Notes version of the retirement benefits. Now, I'm no scholar, but I grew up in Arkansas, and I like to think it's very easy to understand. But if you'd like to download a free copy, you go to thepostalbook.com, download a copy, or you can order a hard copy. The hard copies are $35. Printing costs went up a lot since coronavirus. I also use a union printer, so the cost is the cost. But I've had a lot of people order that. Just want to make sure I didn't forget, okay? Any questions so far on the life insurance? You can reduce it or cancel it at any time. The other thing I want you to know is when you retire and you fill out your paperwork, if you pass away, your kids are going to have to provide some documentation. It's not going to say Metropolitan Life. It's not going to say so-and-so insurance company. It's going to look like this. Continuation of life insurance. When you retire, I tell people this in seminars, make sure your smartest kid, we all know there's one that's, pretty sharp and one that's sometimes not. Make sure they have a copy of this form. Actually, I say give a copy of all of your retirement paperwork to one of your heirs that you trust, because odds are this document's going to be needed, because if you pass away in retirement, I get these calls all the time. My dad retired 20 years ago. We don't know if he had insurance or not. This is your proof of insurance, okay? Continuation of life insurance is actually part of your retirement paperwork, all right? Any questions so far? You guys have been a quiet group so far. Now I'm going to ask her to answer the Medicare thing. So 2025 is when the new Medicare rules are going to go into effect for federal employees. So up until then, you can do whatever you want. You can have your postal health insurance. You can still have your postal health insurance after that, but Medicare becomes primary, okay? So you're going to have, you can keep your same doctors, medications. Most people are able to go on Medicare and save a lot of money. But it depends on where you live, what prescriptions you're taking, things like that. So again, it doesn't take effect till 2025. But when it does happen, you're not going to lose any coverage. The people that have to utilize health insurance a lot, let's say they're pretty sickly and they've got a lot of stuff they need, they would enroll in Medicare A and B, and then they could still pay for the postal health plan on top of that and basically have a zero out-of-pocket medical expense situation. You can still have a zero out-of-pocket with Medicare A and B. But no one's losing health insurance. It's just when it comes 2025, the government wants to push people into paying into Medicare and using that versus paying out of the federal health plan because they want to save money on the health plan, I guess. I mean, I don't know what their motivations are. They're not always pure, but that's what's going to happen. I hope that answers your question. You will become eligible after you retire. Some of you that are working past 65, once you retire, you're eligible to enroll in Medicare, but you don't have to until 2025. One of the things I will tell you as well is, let's say, all right, I'm on the federal health plan and I sat down with a Medicare expert. We do have Medicare experts on our team that understand the federal health plan as well as Medicare. So just comment, text us, let us know if we can help in those areas. But you don't cancel your federal health insurance if you're going to go try Medicare. You suspend it. It's like stick a tack in it. If you want to come back to it, you can come back at any time. If you cancel your federal health insurance, you can never come back. The word suspend is very important, okay? Very, very important. Hope that answers your question. Does that answer your guys' questions on the Medicare? I'm not a Medicare expert, but I know enough about it that I can kind of give you guys some input, right? You can have one or both, and it really just depends on your situation and how much you want to factor in the cost. A lot of people are able to go on just Medicare, suspend their federal health plan, and it's a lot cheaper. And they get the same benefits, same health care, same doctors, same prescriptions, you name it, okay? My parents just went through a scenario, talked to one of the guys on our team that's a Medicare expert. Now they're saving $800 a month that they were paying on Medicare. So it's important to talk to somebody that knows what they're talking about and not somebody that just, sends you a letter in the mail, okay? Any questions so far on that? And then we're going to get into some of the retirement stuff, okay? I lost anybody? Nope, we're doing well. And my iPad keeps timing out on me. I apologize, guys. Let's talk about sub time. Who had some sub time out there? Now, I'm going to warn you, if you were a TE, TEs came about way after the point of time where you could buy your sub time. Casual or an RCA or some of those others, the key is sub time that you can buy had to be served prior to January 1 of 1989. That's the rule. They haven't changed it. I don't really see them changing it anytime soon. If they do, it'll be a big deal, and your union will probably publish that in their newsletters. But the time that on your sub time, it has to be served prior to January 1 of 1989. That's the key. So I had a lot of questions on sub time and tried to answer a few of them as they came up. But that's why you want to try to get those career positions. I've met people that were subs for 10 years. I mean, and unless you're saving money on your own, I mean, you can't wait till you go career. You need to start really looking out for yourself earlier, okay? Most of you are FERS employees, right? So we want to make sure you guys understand the basics of FERS, all right? I'm going to find my visual here. I like pictures. If you're a FERS employee, this is what your retirement is comprised of. 3 pieces: pension, Social Security, and TSP. There's a lot of employees that have been working there for 15 years and still don't know that. Now, if one of those legs, now you can't really do a whole lot about the pension. That's just a measure of how many years you work and your salary. The Social Security, you can't really do a whole lot about that either. It is what it is. But the TSP, that's where somebody can really either be deficient or ahead of the game in terms of how much they're putting in there, okay? And this is where I'm going to, wow, look what happened to there. There we go. This is where I'm going to answer the question that was about, how do you figure out how much money you can get out of your TSP in retirement? So we want to be conservative, right? So as a general rule, assuming you can earn 4% on your retirement money after you retire, and this assumes it's in an account that doesn't ever lose money. Now, this is where, we have accounts that are a bank, right? That's never goes down and never earns anything. Could never pay 4%. Actually, some of them are paying a little more than 4%. There's treasury bills that are paying that, but never more than that. Then you have your stockbroker who can't give a guarantee, but you may do really well one year, and then this year you're trying to get back to even, right? So when we say as a general rule, for every $100,000 you have in a TSP is about $400 a month in income you can count on. So if somebody has $300,000, $1,200 a month is a pretty conservative figure. Again, if you've parked your money in a spot that's going to earn 4% more years than it's not, and if it's an account where it can't go backwards. That's the important part, is to make sure you have it in a place that's safe, okay? Some of you that aren't able to hear me, turn up your volume on your phone or on your computer. Again, if you have questions, you can always call this phone number, 314-916-8858, and ask whatever question you want, okay? We're not going anywhere. I hope that answered your question, Elizabeth. Don't let people tell you you're going to get 8% on your money consistently. It's just not going to happen. 8% average is not 8% consistent, because there's a 0, 14, 0, 16. That might average out to 8, but your actual money is not going to show 8% growth. I hope that makes sense. Okay? Where's your questions at? There has to be some questions right now. Let's see here. Those of you that have your 30 years and are over 60, you need to get on the phone with us. You have options. You could probably retire making the same money you're making now, and you don't know it. Okay? There's no reason to sell your life to the Postal Service any longer if you don't have to. Okay? Some of you have saved enough money in your TSP to retire completely comfortably, and yet you're still working, putting money in your TSP that your kids are going to blow if you pass away early. Go take care of you. That's just my personal opinion, okay? Take care of you. They can take care of themselves. And as some of you guys are, need to look out for yourself. All right, let's move forward. Not many questions. Guess you guys have been well read somewhere. Also, let's talk about, so I talked about the stool, right? Pension, Social Security, and TSP. Let's talk about your minimum retirement age. There's people that don't know what that is either. Let me pull it up here. On the left, that's the year you're born. On the right is your minimum retirement age. The age you can retire with 30 years of career service. Okay? 30 years. If you are not going to work 30 years and you're going to work 20, then you can retire at age 60. Or you can retire with at least 5 years of service at age 62. But this is the minimum retirement age. Most of you, it's going to be 56 to 57. You have to get to those ages to avoid a penalty on your pension, as well as, in a lot of cases, maintain your health insurance into retirement, okay? Do I have any questions on minimum retirement age? Everybody wave your hand if you can hear me. I had one person say they couldn't hear me. I see the chart here. Everybody give me a thumbs up. You can hear me? I have to rely on technology. I don't know what you're seeing on your end. I could be at the mercy of the computer. Military buyback, Michelle. If you've retired from the military, you don't want to trade that in for a postal pension. Keep your military pension. But let's say you served 4 or 5 years in the military and you didn't retire, but you never, it's just sitting there. You can actually have that time count towards your postal retirement. You'll have to pay 3% of what you made way back then, okay? Plus an interest factor. And so there's not many times where I'll say every time you should. But in this case, when you're buying military time and you haven't retired from the military, you have to buy the time. And it needs to be bought, paid for with your receipt in hand before you choose to retire. Again, it's not going to cost you much, but every year you buy adds to your postal retirement and reduces the amount of years you have to work. That's a big deal, okay? You're talking, I hate to give a number, but most times it's less than $1,000 or $2,000, and they'll let you pay for it out of your checks to $50 a pay period if you want. But the key is to get it paid for sooner than later. How do you do that? You call Shared Services, 877-477-3273. Say, I need to buy some military time. They'll mail you a package. You'll get copies of your DD-214s from the branch of military you work for. Fill out the forms. You mail it off. Then they send you a letter back that says, you need to pay this amount for these years to count towards your postal retirement. That's as hard as it gets. But the sooner you start paying on it, the cheaper it's going to be. And don't wait till you're about to retire, because then, you have to have it paid for before you retire. Here's what I'll say on the health insurance. Everybody's different in every area. And when it comes to health insurance, especially Medicare, your zip code matters. Not even the state, your zip code matters. It also depends what doctors you use, what prescriptions you're using. It's different. So don't assume what Sally did is going to work for you. You got to talk with a Medicare expert and make sure you get the correct recommendations. And here's how you can make sure you're getting the right recommendation. They need to know every one of your doctors, and they need to know every one of your medications. Then you know, if they don't have that information, they might recommend the wrong plan for you, okay? If you retire on disability, do you still get dinged on the pension for not being 62? No. Disability retirement, it takes a while to get approved for that, but you get 60% of your salary in the first year after you're approved, then 40% of your pension every year, for 40% of your salary up till you turn 62, and then when you turn 62, they pay you as if you worked until 62. So there's really not a penalty on the disability retirement. If you can qualify for it, it's a pretty good option, but it's a lot of paperwork, and I hope you have some doctors that cooperate with you too. How much is your annuity reduced when you elect a survivor benefit? Good question. I'm going to try to use my iPad here. I like to draw things out. When I do a seminar, I love my flip chart, but I'm here, so you know how that is. Hang on one second. Let me get the right size ink here. 10%, 50%, and then 5%, 25%. All right. So 10% of reduction in your pension will give you a 50% survivor benefit to your spouse. A 5% reduction in your pension will give you a 25% benefit to your spouse, okay? So let's look at some real numbers. If my pension is going to be $1,500 a month and I want to give my spouse a full survivor benefit, it's going to cost me $150 a month. But if the employee passes away before the spouse would get $750 a month for the rest of their life, the 50% benefit. The real big thing about survivor benefit is that you have to give your spouse a survivor benefit in order for them to maintain health insurance if you pass away before they do. So it's real important you give, unless your spouse has health care and retirement forever, we almost always recommend that survivor benefit because that entitles them to not only some money, but also health care if the employee passes away first, okay? What if you bought it back and shouldn't have? Michelle, if you're talking about military time, actually just send us a text, Michelle. I don't want to get too personal. 314-916-8858. All of you should write that number down. Put it in as your retirement guide number. Ask the questions that come up later. You're not going to think of all the questions you have right now, right? But that line's open 24/7. Don't always answer right away, but you'll always get an answer, okay? When you've turned 59 and a half, can you roll the money out of your TSP while you're still employed? Absolutely. It's called an age-based in-service withdrawal. There's lots of people that want to get away from the TSP when they turn 59 and a half, not because it's a bad thing. It's because as you get older, what works in accumulating money is not always as good in distribution phase. Because when you're working, you're in accumulation phase. When you retire, you're in distribution phase. And the TSP is somewhat limited in the fact they don't have an account. If you remember what I was talking about earlier, they don't have an account there that's guaranteed that also earns a fair amount of interest. They have the guaranteed funds, G and F, and they have all the others. And all the others have been up and down like a seesaw here in the last couple of years. But there are some options in the private sector where you can have the guarantee and do pretty well. So that really just depends on your situation. But yes, you can roll it out. There's no taxes for the rollover, okay? Whatever money you put in the IRA, no taxes. There is a way for you to valve off 10 or 20 or 1,000 or whatever you need. We have a lot of people when they retire. I talked to a guy years ago in Massachusetts. He goes, "Hey Dave, I want to retire, but I promised my wife I'm gonna get her a new kitchen." I'm like, "Well, how much is the kitchen?" He goes, $10,000. So when we did the rollover, we valved off $10,000. So Mama's happy with a new kitchen and he's happy he retired. So there's all kinds of things now, but there are people out there that don't know what they're doing on the rollover, and don't necessarily have your best interest at heart. So you got to be careful. These guys that are trying to come out to your house and sit down at your kitchen table, not something I would do. Okay. These are the people that will do what's best for them, not what's best for you. Okay. John, if you have any questions, text the number. But that's a big deal. I had another question on TSP. I'll come back to you here in a little bit. Mary Sedlak Binion, if that time was before 1989, it's always worth buying it. It shortens the amount of time until you get paroled from the post office, right? So yes, I would encourage you to buy it. It's not that big a deal. If you retire at 63 and not take Social Security until you turn 67, will that increase your Social Security? Yes. It goes up 8% a year. So, and there's all kinds of books out there that should you wait on Social Security or should you draw it early? It's out there. Just read up on it. Make a choice based on what you think's more likely in your situation, and go for it. I don't really have an opinion on when you start Social Security, but they don't freeze your Social Security until you start drawing it. Okay. Spousal benefits. Do you have to keep spousal benefits if you want to keep them on your health insurance? They don't have to be on your health insurance. You know, you could retire and they could be on their own private health insurance, but every open season, the spouse can come back on and add themselves to your insurance, Shelley, if that makes sense. Both of you don't have to have it the whole time. But when you retire, okay, you need to give them a survivor benefit, and that means if you were to pass away, that would open the door for them to sign up for your health insurance. Now, when it comes to the employee, you have to be paying for health insurance out of your check stub for the 5 years preceding the day before you retire. Okay, it doesn't matter what plan. It doesn't matter if it's rural letter carriers, if it's mail handlers, APW, whatever it is, or just straight from the post office. Doesn't matter what plan. As long as you're paying for health insurance out of your check stub for the 5 years preceding your retirement date, you can bring it with you into retirement, okay? Good questions. You know what? I see this hip replacement, Dave. Guys, some of you guys are low on sick leave. You came back from surgeries, or you have friends that have burned up all their sick leave. Guys, disability insurance is important, because if you get hurt again or if you have a recurrence, you're not getting paid. So I always recommend a year of sick leave. Once you've got a year of sick leave, you can pretty much deal with just about anything that might come your way. Some of you guys are walking around with less than 200 or 300 hours, and that's just that's dangerous. If you need some assistance in finding a plan, we can do that for you. But don't walk around without. That's not something to mess around with, because I get calls all the time. People that need surgery, no disability, and they have no sick leave. All right. All right. Good deal. Great deal. I like seeing that. All right. Now, one other thing I wanted to cover is another question that came up earlier was, if you retire, can you pull money out of your TSP before 59 and a half without a penalty? The answer is yes, as long as you retire over age 55 and you're taking the money from the TSP, not from a private IRA. So if I'm 57 and I retire and I leave some money in the TSP, I roll over part of it somewhere else maybe, but I leave money in the TSP. You can draw that money out of the TSP with no 10% penalty. You're just going to pay taxes. Once you turn 59 and a half, then you can start drawing from your other IRAs or whatever you may have. But it's important. You have to have retired at an age over 55, and the money has to come from the TSP to avoid the 10% penalty, okay? Now, that's information the average guy doesn't know, that all of our people know. Now, one thing I haven't brought up is our list of seminars coming up. In case you guys are in any of these areas. Now, I know sometimes it can be hard to see. We're all over the place, okay? That's a lot of seminars. Odds are we're going to be in your area this year. Are you guys able to see that, I hope? Give me a thumbs up if that's visible. I assume it is. Lots of Maryland, Georgia, Illinois, California, you name it, we're going to be there. It's just a matter of you guys letting us know, okay? Let's see here. If the postal insurance plan becomes secondary to Medicare, will the premiums go down? I don't say they're going to reduce the postal health insurance premiums. No, they're going to leave it the same. They just want less people in retirement on it. They want to reduce their costs. I'm sure the insurance companies are in their ear to either lower it, if we got too many people on the program, whatever it may be. The bean counters behind the scenes, I'm sure, have influenced that, but I don't think the premiums are going to go down, okay? And Deirdre, in New York, we do try to get to upstate New York once a year. New York's got all kinds of regulations that allow us to do what we normally do in other states. So I hate to say that, but we can have a phone conversation with you. I suggest you download my book. That would be fantastic, okay? I'm not sure I understand your question, Kelly. Is it better to use your sick leave before you retire or save it? It is better to use it, but don't start using it until your final year, okay? Like I said, you want to have at least a year of sick leave and until you know you're going to retire, because the sick leave is like $5 a month you get paid on your pension for most of you. And 1 month off pays you $4 or $5 grand, right? So it literally would take you 1,000 months of retirement to get that money back. So if you're able to take sick leave before you retire, it's called the FERS flu. Everybody gets sick before they retire. Plus, you also want to make sure you get a full physical before you retire. If anything's going on, you would rather have that work done on your full-time salary on sick leave than in retirement on a partial income, right? Deirdre, possibly downstate. So do me a favor, send us a text, 314-916-8858. And let us know where you're at. We can try to work with you, okay? By the way, any of you guys that are working a plant or in a large facility and you don't see your city listed on our list of seminars here, send us a text message. If we have somebody on the ground that'll help us spread the word, we'll have a seminar right in your backyard, as close to your facility as we can get one. We want to go where there's people we can help. Sometimes we just have to guess, and sometimes we don't have a good turnout. We'd much rather have your help, right? So you guys let us know where you are, and we can try to get you a seminar in your backyard, okay? What other questions did you have? I'm looking at my notes here, make sure I don't forget anything. I showed you guys the FEGLI cost. I showed you how to reduce your life insurance. Is anybody looking at retiring early before you're eligible? If you don't have your minimum retirement age and you don't have your 30 years, then you're looking at either a deferred retirement or a postponed retirement. Two big things. So now what I would encourage you to do, instead of covering it here, that'll be another live session I'll do, is I want you to make sure, get to your minimum retirement age if possible. That allows you, if you retire early, to bring the health insurance with you into retirement. If you don't get to your minimum retirement age, I'm going to bring that up again, then you won't be able to bring health insurance with you into retirement. That's kind of a big deal. There's your minimum retirement age. Those are big dates, okay? Thank you, Charles. Dallas, Texas. Annie, we have one coming up. I don't have the date right off the top of my head. We usually do a Fort Worth and a Dallas in back-to-back weekends. So Annie, do us a favor. Use that text number that we have above. Send us a text. Say, hey, my name's Annie Joseph. I'd like to go to a seminar, and give us your phone number and your address, and we'll notify you. That's how hard it is. Remember, thepostalbook.com to get a copy of my book. You guys, I'm actually all open for questions here. Let's see. I thought I'd have a few more, but you know what? You guys are a smart group, right? Let's see here. Colorado. If you're in Denver, we're definitely going to be in Denver. It becomes difficult if you're out in like Grand Junction, Colorado. That's a long ways away. And so we've got to know that we've got enough people that are going to be there. So we got to have some help when we're going to those rural areas. But most of the major metro areas, we're in at least once or twice a year. Is the health insurance premium the same in retirement as it is where we're working? No, it's not. So right now, as a post office employee, you are subsidized by about 25%. When you retire, you lose that subsidy because you're no longer an employee of the post office. You're a retiree. So normally you're looking at $400 or $500 a month. I haven't looked at an annuity estimate in a little while, but $400 or $500 a month for a self plus one is in the right range. So one way you can find out what your health insurance is going to cost you in retirement for the exact same plan you have now is going to Light Blue, going to My Retire, I think that's what they call it, and pull up an annuity, an estimate for a specific retirement date, and the health insurance in retirement is mentioned on that form, okay? What's your question about basic life insurance at 65, Deirdre? At 65, so I'm going to go back to this form that I showed you guys. Where is it? This form here. This is the form you use to cancel or reduce your life insurance, okay? And so when you retire, you're going to sign and keep your basic, and then you'll have an opportunity. I'm sorry, this is the wrong form. Let me pull this up. You're going to have an option on your basic life insurance. Do you have basic? The answer will be yes, because you guys are all postal. And then do you want a 75% reduction in your basic, a 50% reduction in your basic, or no reduction in your basic? The no reduction will cost you about $100 a month. 50% will be about $50 a month. The 75% reduction will be about $15 a month. But then when you turn 65, you don't pay for it anymore. So a lot of you will have a free burial policy from the Postal Service. So when you retire, make sure you keep at least that 75% reduction of your basic life insurance. You're only going to pay on it until you turn 65. Then it's free for the rest of your life, which is why you want to make sure you have this form. Make sure your kids have it. That's what they'll need to file a claim when you pass away, okay? 65, plan to retire within the next year. Here's what I tell all of you guys. You want a quick snapshot of what your pension's going to be? 99% of you, it's 1% for every year of service. So you got 30 years of service, you're going to get 30% of your salary as an annual pension amount. So if I'm making 50 grand a year and I get 30 years, that's 12,000. Well, you know what? That's 15 grand a year, right? You divide that by 12. $1,250 a month is what you get on your pension. That's a 30-year career. So if you're doing less than 30, it's still 1% a month. The only exception is if you get to age 62, you get 1.1% for all of your years. So it's got like a little 10% bonus if you can get to age 62. So, Vicki, you would be getting 13% of your salary as a pension, plus your Social Security, plus your TSP. And if you're not sure or you're not confident you can run those numbers on your own, text us, comment, reach out to us. Let us know. I haven't brought up our phone number. I apologize for that. That's our actual phone number during the day. You can leave us a message. We'll get somebody to reach back out to you. These are numbers you should be writing down because you're going to have other questions once we're done here, and you're going to want to reach out, okay? I'm going to leave that up there because you don't really need to see my face too much. Let's see here. Once you get, Lisa, good question, 56 and 2 months, if that's your minimum retirement age, you don't have to keep the 2. You just got to get past that 57 and 2. Okay? Doesn't really matter. You don't have to maintain that. I've actually never had that question. That's a good one. How do I get paid for our services? Good question. So we're very fortunate to have thousands of postal employees attend our seminars every year. We've got a good reputation, been doing it 15 years. If we're in a room, we had a seminar in Fairfax, Virginia last week, had 90 people show up. In that room, there's going to be 10 to 15 of them that are wanting specific help, and they want services or products that are outside what the Postal Service offers. And so instead of them walking out on the street and hoping they can find the best resources locally, we actually refer them to companies who have helped postal employees just like them for the last 15 years. And those companies pay us for referring them over there. So we're basically a walking billboard service. You don't pay us a dime. You can leave your checkbook and your wallets at home when you come to the seminar. If you need our help, great. We'll refer you to somebody. If you don't pay a thing for attending the seminar. Come in, ask your questions. One thing that's really unique about our seminars is our guys don't use a PowerPoint and read the words to you. Talk about annoying. They know their stuff. They know it. We don't deal with mediocrity on our team. Everybody knows what they're doing. Everybody has counseled thousands of employees, and they can answer your questions with confidence. Okay, that's why going to a seminar is pretty priceless because you get the seminar environment, but then following that, you can set up a one-on-one and review your specific situation, and then they can also review any other options you might have that might interest you. Okay. So, Paul, I hope that answers your question. I'm going to say again, beware of advice from your coworkers or the Facebook groups. That's not where you want to get your information, okay? You wouldn't let your buddies at work prescribe a medication for you. Don't let them prescribe what's right for you in retirement. Just trying to make sure. People get misled so many times. The groups that I'm a part of, I have to come behind people and correct them. It's important you get the right information, okay? Not just what's easy, okay? I think I missed a question here. If I have 25 years and going to be at 60, can I retire with full benefits and keep the insurance? Absolutely. Remember, there's 3 windows. Your minimum retirement age with 30 years, age 60 with at least 20 years, and age 62 with at least 5 years. Those are your 3 finish lines. And you need to hit one of them, all right? Otherwise, you would need to talk to us and make sure you're not leaving some benefits on the table, okay? Let's see here. The follow-ups, we don't charge anything for the follow-ups either. Because here's what happens. We do enough seminars. Here's what you don't want. You don't want Joe Blow, who was by himself, doesn't have an organization. He talked to a life insurance company. He wants to sell you some life insurance. He wants to come out and sit at your kitchen table. Just one guy, right? That's the worst scenario ever. We're an organization. We do 300 seminars a year. We have enough people that raise their hand and say, you know what, Dave, I'd like help with this, or this. We refer them, and those companies are grateful to have those customers. And so they'd rather pay us than pay a marketing service, right? So we don't have to charge you to do anything. 80% of the rooms people that come to our seminars, they don't buy anything. They don't do anything. They just come and get the information. I'd encourage all of you to go check out our reviews on our Facebook page. You're on our Facebook page now. Just click on the reviews and read the words. Don't take my word for it. And we've also been, you can see the page was started in 2009, A+ rating on the Better Business Bureau. Whatever you want to check out. We've got everything looks good. And, if you're wanting quality information, you should probably go to somebody that can do it off the top of their head and not try to find the answer in a book. Imagine being on an operating table and your doctor's trying to find answers in a book next to the operating table. That is not what you want, right? Not what you want. All right, let's see here. Oh, the supplement. Good question, Elizabeth. I always get a question on that as well. Thanks, Charles. So the the supplement, excuse me, is for people that have reached their minimum retirement age and 30 years of service, or age 60 with at least 20 years of service, okay? So I'm going to try to draw this here, try to make it a little easier. So if you qualify for the supplement, What they're going to do is take your years of service. So let's say Joe has 30 years of service. They're going to take the 30 years of service he has, divide it by 40. Whoop, wrong note. Ain't you love technology? 30 divided by 40. His 30 years of service, Postal Service says divided by 40, that gives you 0.75, right? Now you take that 0.75, and let's say Joe's Social Security at 62 is $1,200. So they'll take that $1,200 Social Security, multiply it times the 0.75 that we did in the previous equation. So they'll get $900 a month as a supplement from retirement until they turn 62. Then at 62, you'll have a choice. The supplement's going to stop no matter what when you turn 62. But then you'll have a choice of whether you want to start Social Security at 62 or wait till a later date. But the supplement's only going to pay you until you turn 62. And you have to get to either minimum retirement age and 30 years of service or age 60 with 20 years of service, okay? Elizabeth, yes, you can get our help. Just send us a text message or you can call us. I'll bring the phone number up there. We do these. Matter of fact, guys on our team have done so many books that you don't even have to call shared services and get your book sent to you. All the forms in there are standard forms you can download online. Since we know all the forms, we download them for you. You don't even have to call shared services. You don't even have to do a counseling session. They don't, what do they got? They don't, when you do a counseling session for retirement, you share the call with 3 or 4 other people. You can't ask specific questions. They tell you to mail a letter. What kind of service is that? Shared services. I don't know who they shared services with, but either way, we can help with your Blue Book. If you need help with your Blue Book, just comment Blue Book or send us a text message. I should have a bunch of text messages we'll be checking later. This is all the help you need, okay? You just got to step out there and raise your hand and let us know who you are, okay? Let's see here. How much can you make in a job after retiring? It's about $18,000 on a W-2. Once you go over that, you hand back your supplement. For every $2 you go over that, you get $1 taken away. So I think it's 18 and some change, Charles. It's called the earnings test, Social Security earnings test, if you want to check that figure. Special supplement, full calendar years. I do believe that's a good question. I do believe it's completed years, or they may do a percentage. I've actually looked at some annuity estimates that the Postal Service sent out, and they were inconsistent. So I'm gonna say I'm only going to comment on full years. Not certain on the partial, but I think when I know when you do a annuity estimate on light blue, they tell you how much your supplement's going to be. Sometimes it's off though because they're factoring in what your Social Security is right now and not what it might go to. Right? Is the supplement decreased if you make too much money after retirement? Yes. If you make over $18,000 and some change, they're going to penalize your supplement $1 for every $2 you go over that. Okay. Let's see here. And again, I don't know how, just a little, not advice, but a personal opinion. There's been a lot of topsy-turvy stuff going on in the TSP right now. There's no guarantee that it's going to get back to where it was. So those of you that get sick to your stomach when you see it go down, you might want to look at your options, okay? You might want to look at your options. There's some unprecedented stuff going on right now. I don't care what side of the political fence you're on. There's unexpected things happening. And what has happened in the previous 10, 20, 15 years is no guarantee it's going to repeat itself. We've got crazy, crazy stuff going on that none of the we've never seen before, okay? How soon before retirement should you get the Blue Book? Again, you don't even have to get it. You can call us and we can print them off for you. But we generally say at least 60 days prior to the day you're planning on retiring, okay? 60 days prior. We also have a website if you want to request our help with Blue Books. There it is. PostalRetirementPackage.com. You go to that website. Sorry. You guys tell I'm not a computer guy. I'm actually not bad, but this thing I use for these live sessions is complicated. And you guys are going to have to bear with me. It's .com. There we go. Fill out the form. We'll connect you with somebody on our team. Easy peasy. Zero stress. Some people need help with their Blue Book. Some people don't. And I get people all the time. Why do you help? You don't need help. Well, some people, just like some people in school made straight A's and they didn't have to study. I had to study. If I needed help. If you need help, come get it. Okay? Come get it. Elizabeth, I want to have you text me that question and we can get more specific on what you're talking about, okay? Let's see here. Hang on one second. I don't have a moderator, so just bear with me. As far as workers' comp on your pension, we are not experts on how workers' comp works, but from what I've understood, talking to some union stewards and a lot of people that have retired, anything less than a year that you miss due to workers' comp does not penalize your pension. If it's over a year and you're not working at all, then they would penalize you. But if you're at least doing light duty, again, this is an area that we don't get a lot of specialized training on, is the labor side of things. So don't want to, say I know, but I do know that if you're not working at all for over a year due to workers' comp, that they will reduce your pension for that. Because when you fill out your paperwork for retirement, they ask if you have any workers' comp claims, and if so, what's the claim number and what period of time. I hope that answers your question. Ron, how much notice do you recommend? I'm not sure what you're talking about there. And I'm going to pull these seminars back up in case we have some new people that came on. Again, these seminars are about an hour and a half on a Sunday. It's not 4 hours. Anybody that wants to talk to you for 4 hours, it's a waste of time. There's just not that much to talk about in a general setting. That's what the one-on-one appointments are for, okay? So it's real important. So let's see here. Let's see. What else? Give me some good questions. These have been good. We've got quite a few people involved. Again, if you have friends that are near retirement, be sure and tag them, okay? No, workman's comp is not the same as FMLA. Workman's comp is injured on the job, which goes back to saying disability is important because a lot of times the Postal Service is not very quick to approve a workers' comp claim, right? The one-on-ones are about 30 to 45 minutes, depending on how many questions you're asking. We generally allot an hour, and within 15, 20 minutes, we can have your retirement income figured out. That's how long we've been doing this. If you know what you're doing, it doesn't take forever, okay? It really doesn't take forever at all. What other questions did you have? Oh, Dawn. Can you retire at your minimum retirement age in 13 years of service? No. That would be a deferred retirement. You have to have your minimum retirement age and 30 years of service, okay? Or age 60 with 20 years of service. But you would definitely want to get to your minimum retirement age no matter what, to be able to keep your health insurance into retirement. So again, based on your year of birth, there's your chart. So you need to get to those. You get to those ages right there in the right-hand column, you're able to keep health insurance. Okay, kind of a big deal. Kind of a big deal. All right, we've been going about 52 minutes here. I'm going to sign off here. Please write down the text number. 314-916-8858. Shoot a message over. I need to have my numbers run. I need help with my blue book. I don't know what the hell kind of life insurance I'm paying for, but it looks like it's a lot and I want to change it. What about my TSP? When I retire, what can I get off of it? How long is it going to last? These are things we help people all the time. All the time. Also, you can still comment, and those of you that are coming in and maybe you see this live session tomorrow or 3 days from now, you can still comment on the post, ask a question. We'll still answer it for you. But I really encourage you to save the 314-916-8858 number. That's just a direct line, right? And sometimes when there's 400 comments on a post, like there will be on this one, your post can not get lost, but overlooked. So I appreciate you guys watching. Also, remember my book, thepostalbook.com. If you want to order a hard copy, you can do it on the website there, but just really want to try to connect you guys with the information you need. Please do me a favor. If you thought this was helpful, tag a few of your friends, because they don't trust us or me, because some of them have never heard of me. But if you're telling them about us, you've kind of qualified it for them. There's nothing like a referral, right? Friends let you know it's safe. So I appreciate you guys being on tonight. I want you guys to stay safe. Don't listen to your buddy at work on retirement. Tell him to just go back to your case and do your job. You guys stay safe out there.